Hi everyone, I want to talk about broad-spectrum anti-epileptic drugs, that is, could be used for both focal and generalized seizures. If you want to know more about the rest, that is, for absent seizures and focal seizure disorders, kindly check my presentations. I have them already published. Okay, let's go. One of the leading broad-spectrum anti-epileptic medication is levetiracetam. The trade name is Keppra, but the side effects will include infection, fatigue, somnolence, dizziness, agitation, anxiety, depression, or irritability. Also, you're going to have anaphylaxis, that is likelihood, Stevens-Johnson syndrome, toxic epidermal necrolysis, angioedema, psychosis. I've highlighted that. Psychosis, Pancytopenia, or Hypogammaglobulinemia. So levetiracetam, Keppra could be used intravenously or per oral, but we could use it either for focal or generalized seizure disorders. Valproic acid or sodium valproate is very good as broad-spectrum anti-epileptic drugs for both focal and generalized seizures, even in absent seizures. It's used in many ways, but you'll be dealing with weight gain, nausea, vomiting, hair loss. Mark that, hair loss. Hair loss, unlike phentoin, that will give isodicin. This will give hair loss. Could have easy bruising, tremor, dizziness, and polycystic ovarian syndrome, particularly in young women. And think about this. Someone is already diagnosed with polycystic ovarian syndrome and is now placed on valproic acid or sodium valproate. Then you are worsening the situation for the individual. It's likely going to lead to Stevens-Johnson syndrome or toxic epidermal necrolysis in those who are hypersensitive to the medication. How about Agranulocytosis, on account of which many will come down with infection as well as Hypogammaglobulinemia. Serum sickness is possible, and hepatotoxicity that will lead to hepatic failure is likely here. That is even the major reason why sodium valproate is not prescribed to many people. But you've seen many other reasons why we may not prescribe it, or when it is prescribed, what we look out for. So, like polycystic ovarian syndrome in young women, but if this is a young man, you don't need to bother about that. Okay. Pancreatitis is also possible with dermatitis as well. So watch out for those possible side effects in yourself or your loved ones that are taking valproic acid. It's a good medication, but watch out for this. You can pause to go over them again. TOPIRAMATE. TOPIRAMATE is pretty good for both focal and generalized seizures, but you'll be dealing with weight loss, Paraesthesia, fatigue, nervousness, low level of consciousness, confusion, depression, anxiety, tremor, language problem, and anorexia. But I've highlighted glaucoma or acute myopia. You need to know that, particularly in elderly prone to glaucoma. Be careful with TOPIRAMATE. Also, nervousness, that is kidney stones, Hyperthermia or Oligohidrosis, also possible here with TOPIRAMATE. Clobazam. In fact, as a matter of fact, I will be choosing clobazam and levetiracetam most of the time. Clobazam will be on top of that, not promoting or letting down any other medication, not an agent of the company manufacturing clobazam in any form, just talking about a good medication. Because the side effect is minimal, with only nausea, hypersalivation, vomiting, constipation, and respiratory depression. Just need to watch respiratory rate and know that this individual is not prone to respiratory depression like somebody having respiratory disorder like COPD, asthma, and so on. And there's likelihood of Stevens-Johnson syndrome or toxic epidermal necrolysis. Pyramate is also good for both focal and generalized seizures. And I'm going to be dealing with nausea, vomiting, anorexia, weight loss, insomnia. Okay, somebody, an elderly man or woman dealing with insomnia before, and now you want to place on anti-epileptic drugs, you can choose any that leave out Pyramate because you're going to be dealing with more insomnia. Dizziness, headache, ataxia, and aplastic anemia, so on account of which you're going to be checking the complete blood count frequently. Liver failure is a possibility with Pyramate. Zonisamide. We're going to be dealing with possible nausea, anorexia, somnolence, dizziness, ataxia, confusion, difficulty concentrating, depression, rashes, Stevens-Johnson syndrome, or toxic epidermal necrolysis, aplastic anemia, agranulocytosis, kidney stones, fever, and hyperhidrosis. Brivaracetam, with brivaracetam, sounding like levetiracetam, you are going to be dealing with nausea, vomiting, constipation, headache, somnolence, dizziness, fatigue, ataxia, abnormal coordination, and I've highlighted nystagmus. I've highlighted hypersensitivity with bronchospasm, and with that makes this medication contraindicated in asthmatic patients. Bronchospasm. Also possible will be angioedema, leukopenia, neutropenia, on account of which many people on this medication will be coming down with opportunistic infections. And of course, we're going to be dealing with possible psychosis. Berampanel will give weight gain, fatigue, nausea, dizziness, somnolence, irritability, gait disturbance, force, and aggression. In fact, this is with due respect to everyone on this medication, this is somehow hilarious. How could somebody with gait disturbance and force be aggressive? No, while trying to attack anyone and he or she is punched a little bit or just pushed a little bit, it's going to fall off there. So it's just going to be aggressive for nothing and just be suffering. Okay, then mood changes. That aggression might be non-physical, might be verbal aggression. Rufinamide. Rufinamide will be the last medication to talk about when it comes to broad-spectrum anti-epileptic drugs. And when someone is on rufinamide, then you're likely going to see nausea, vomiting, fatigue, dizziness, somnolence, headache, Stevens-Johnson syndrome, toxic epidermal necrolysis, dermatitis, or rashes. Note this. There's likelihood of shortened QT interval. I have made a separate presentation on long QT interval, but you are going to be faced with shortened QT interval when someone is on rufinamide. Actually, short QT interval is a very common, not very common, is known mostly to be as a result of genetics, inherited or congenital problem. But there are other also possible causes, but now we are dealing with rufinamide as a possible cause of shortened QT interval. The individual may have normal life, but majority will actually come down with arrhythmia. Some will have atrial fibrillation, and some will have syncope, and there could be sudden cardiac death from using a medication to treat seizures. Okay, the sudden cardiac death could be as a result of ventricular tachycardia that will worsen to ventricular fibrillation. From there to asystole, and death. Just like the way we found in long QT syndrome that could progress to Torsades de Pointes, and from Torsades de Pointes to ventricular tachycardia, then ventricular tachycardia to ventricular fibrillation, asystole, and sudden death. And with that, I come to the end of presentations as far as anti-epileptic drugs are concerned. Kindly go over all the 3 separate videos, pause to study the possible side effects that your patient will be dealing with. Or if you or your loved ones are on any of these medication, play pause to see the side effects of the very one your beloved person or your patients or yourself have been placed upon. And you don't need to quarrel or fight your doctor. Just walk to your doctor with this presentation and review the medication together. I'm not treating you, I'm only guiding. Kindly subscribe to my channel so that you can get my presentations immediately they're published. Thank you.